Hi there. So a really important question is, how can I tell that my breastfed baby is getting enough milk? Because I know that lots of mums and lots of parents really do worry about this question. I know I did myself with my two as well. And it can be difficult in the beginning to understand that, things are going well, or if there's any issues that I need to seek help with. But there are some really easy ways to sort of judge that things are going well. And the first one is nappies, because what goes in has to come out. They can't make up peas and poos from thin air. It has to be because of the milk that they're taking in from your breast or from your expressing efforts. Thinking about nappies, what we're looking for in the early days is really the number of wet nappies to match the number of days old that they are. And we're talking about heavy wet nappies. So in day 1, we're looking for at least 1 heavy wet nappy. Day 2, 2 heavy wet nappies, 3 heavy wet nappies, and so on until we get to about day 5. And at day 5, by that point, hopefully, your milk will have come in. Although colostrum is milk, so you've always had milk, but in the traditional sense of what we think of as milk, your milk would come in somewhere between days 2 and 5. And when that volume increases, that's when we're looking to see at least 6 heavy wet nappies within 24 hours. Okay, so that's 6 heavy wet nappies in 24 hours from about day 5 onwards tells you that things are going well. And in terms of the poo, basically we're looking for a couple of poos each day, pretty much from day 1. Again, right up to day 5, we were looking for at least definitely 2 £2 coin size poos in 24 hours. And that's your minimum. Your little one might be doing more than that. Fabulous, great. But certainly if they're doing less than that, you would want to seek some skilled help and some information about what could be going on there. So that's 6 heavy wet nappies and 2 £2 coin poos in 24 hours from day 5. And also between birth and day 5, 6-ish, what you're looking for is that transition in colour of the nappies as well. So you're looking from it going from that black, sticky merconium stuff in the beginning right through to a darker brown, darker green, sort of yellow mustardy colour. And you would again be looking for that about day 5-ish to be looking a bit more that sort of yellow colour that we expect from breastfed babies. Sometimes it can be a wee bit orangey as well, and that's also fine. But as long as you're seeing that transition and you're seeing that volume, then that indicates to you that things are going well. The other thing, of course, is their weight. You'll get a weight check when they're born, and then you'll get another one, maybe day 3, that it's very common that often they've lost weight at that point. And again, don't panic, that's really, really normal. But what we would hope for is for that weight to be regained by 2 weeks post-birth, essentially. And again, that's normal. Some might gain it back before that, that's great. But sort of 2 weeks is what you're sort of aiming for. And that we want to see them fall in their sort of centile line within their red book as well. Whatever one it is that they settle on, and follow that, and that indicates as well. The other thing that you can look for when they're actually on the breast and feeding is down here in this jowly bit, you can look for swallows. We want to see nice active feeding where we see these swallows here like that. You can see it happening down here in this jowly bit. So when they're on the breast, they might initially go on and sort of nuzzle, that's fine. But then you want to at some point see some nice, really rhythmic suck swallows. And if you're seeing that here, then they're transferring milk, basically. They're swallowing down milk. So you're not just looking for the jaw moving, you're looking for down here in these active swallows that you can see. And if you see that, then you know they're drinking milk. and it's a lovely sight to see. So hopefully that gives you some idea around ways to reassure yourself that your baby is getting enough. But of course, if you're at all worried, do reach out to us. We're happy to help here at Maddie's Miracle. And of course, you've got the National Breastfeeding Helpline that you can always call. You can look for your local breastfeeding support, your health professional, a lactation consultant. We're all very happy to help you if you've got any concerns and talk things through. But hopefully all is going well and you're doing well. All right, thanks very much. Bye.